All right, Caroline, we shift attention now to typically what we do on Thursdays. We have a member of the medical community come join us and visit us today. Dr. Frederick Meine, a cardiologist with New Hanover Regional Medical Center's Physicians Group, in to talk to us about heart attacks. And there's a lot of, I don't want to say myths, but there are some general stereotypes about heart attacks, and they come on that the symptoms that we see, but those aren't always the true telltale signs of a heart attack, correct?
That's exactly right, Bob. One of the things that's really worrisome is that oftentimes with heart attacks, it's not the classic elephant on your chest or chest pain or shortness of breath that people feel. It can be very vague and atypical symptoms. And oftentimes, unfortunately, that means that people come to medical care too late because they've ignored the symptoms since they're not the classic ones.
Do you oftentimes see people, you mentioned doing it too late, that they may sit at home, feel a little sick, maybe you're out in the yard doing some yard work, and they just think, I've had this before, and they don't call, and they really put themselves at risk.
That's exactly right. Some of the sickest people we see in the hospital are the ones who don't say anything at all until maybe they walk inside from the yard or inside from doing yard work, and their wife notices they don't look well, or their husband notices. And those are the people that show up to the hospital the sickest and are often the most difficult to care for because they've waited so long.
I know I was reading one of the headlines that caught my attention earlier in the week. The mayor of Toledo was involved in a traffic accident, had a heart attack while driving. I don't know the ins and outs if he was trying to get himself to the hospital, but in that situation, you're really stressing people call 911 and you don't try to get yourself there.
Absolutely. We've seen a number of really tragic incidents here in Wilmington where people tried to drive themselves to the hospital and get much sicker, and oftentimes get sicker themselves and even hurt other people. 911 is there for a reason. Our New Hanover 911 and our surrounding counties 911 are absolutely fantastic. And they can not only help you when they arrive, but they can actually diagnose your heart attack at your house and have us pre-notified so that we can be waiting there for you to give you the care you need when you arrive in the emergency room.
How advanced have we come with this now? I know, when I was a child, I heard heart attack. To me, it was a death sentence, and it doesn't seem that's the way anymore.
We've cut, across the country, we've cut mortality in more than half.
Wow.
From heart attack in the recent past, and we keep getting better. I mean, I think it is certainly not a death sentence. And more importantly, we can oftentimes have people home and living their lives in just a few days, even after a major heart attack.
I know this is an easy thing to think about, eat right and exercise, but what are the things that someone can do, especially if there is a family history?
So the easy ones are the ones we all know. Obviously, don't smoke, eat right, watch your cholesterol, but even the little things, it's just 30 minutes of exercise a day, aerobic exercise. And I always tell people we're not talking about climbing Mount Everest. Sure. I'm talking about walking in the neighborhood. Just that can decrease your heart attack risk immeasurably. When
you see someone that is in that critical condition, EMS has brought them to the hospital, how quickly are you able to get in, repair the situation? How quickly are those people back on their feet?
So it's really, that's one of the things that's become really amazing, both in the country and here in New Hanover County and the New Hanover Hospital. We have a policy, a group in place that deals with acute heart attacks, and our goal is to have your artery open within 90 minutes of arrival in the emergency room. And oftentimes, we actually shoot for 60 minutes and oftentimes can reach that. Typically, those people stay in the hospital 2 or 3 days afterwards, depending on what else is going on, and are home with their families doing well and within a week.
It's amazing. It's one of the things when people like yourself visit, I'm amazed now at how quick a turnaround is with procedures like this. Doctor, I appreciate the time.
Thanks for having us.
Thank you. We'll be back.